First of all, I would like, the ILC Congress is really, I think it's one of the best Congress, and I really enjoy all the presentations that were held yesterday, and all the presentations today were really amazing. But I think most of the presentations are addressing the future challenges and the actual daily things that we're addressing. But some uncertainties and unmet needs I would like to address and discuss with you, Maria. What do you think about?
Frankly speaking, as you mentioned, there are a lot of news in the area of the immunotherapy. Maybe this session of oncology liver clinical trials was amazing because the immunotherapy was there, and also the 4 abstracts present combination therapy, that is something new in the field of HCC. But at the same time, despite of the fact we have the combination therapy to work in our clinical practice, that the SOBEVA was positive, we also have other issues that maybe that were addressed also in this meeting, that is the heterogeneity that, as Angela Lamarca presented today, and other things that maybe could be also interesting to share with the audience. Maybe we can talk about the predicted model for assessment the development of HCC. Could you share with the audience this abstract?
Yeah, I like the nice presentation that was presented by Alessandro Vitale from the Italica group, addressing, a new prognostic modeling approach using a time varying analysis. That they showed that using a longitudinal analysis, assessing the probability of survival across all the therapeutics approach was really interesting, and maybe, and I like the discussion after the presentation that was addressed by Massimo Iavarone and Jordi Brooks regarding some selection or treatment selection bias that was addressed by them. And I like the presentation regarding the Metro Ticket 2.0 and the reclassification of the Metro Ticket 2.0 regarding selection mode for liver transplantation. That was presented by Carlos Posito from Italy too. There was a very nice. Sorry.
Maybe Federico, we can mix the presentation from Esposito and also the meeting, the interactive meeting that we have yesterday, that also was led from Mazzaferro, and it was a tumor board, because I believe that is something that we need to address. That is the characterization of the patients. And in this tumor board was very, very nice to see the interaction between the different experts in the field that could reflect what we need in our clinical practice. Maybe we can discuss the other interactive session as was presented this afternoon about the heterogeneity of the tumor and cholangiocarcinoma, that is another tumor in the liver cancer field that also EASL is involved in a lot of initiatives in this regard.
Yeah, well, actually, yesterday the discussion were really great. They presented some data regarding some cases. Regarding some challenges in the daily practice, and I really enjoyed the discussion that they went through different treatment options, from liver resection to liver transplantation and systemic therapies. And the last presentation held from Barcelona was really interesting too, regarding cholangiocarcinoma by Alejandro Fona.
Yeah, and linking also the interactive discussion, it is another thing that I really enjoy in this meeting, that it seems a lot of multi-center, despite of the fact that we're retrospective study, but the interaction between the institutions are great. You are from Latin America, you are from Argentina, as I am, but now I'm working in the BCLC. What do you feel that this type of study could help Latin America to be more close to the other part of the world that maybe was not the case in the past?
Well, actually, we would like to thank EASL for this this communication and this opportunity. And we've talked with ALEH, and we're trying to work together with EASL in not only for observational studies, including multicenter data. We think there is a really gap, and there is a really opportunity to us from Latin America to incorporate and to register prospective data and to present our data that maybe we're really we're not presenting our data, and we're not registering our data, and that is a very big issue for us. And I think that's a really opportunity for us, and an opportunity for coordination and cooperation between EASL and ALEH.
Right. And we talk about the clinical practice, we talk about multicenter study, but what do you think about the studies presented yesterday about microbiota and hepatocarcinogenesis on different profile of immuno-related tools such as neoantigens for liver cancer field? It is a very interesting data, but maybe we need to have more details about that.
No, I think that these data were really amazing regarding microbiota, linking the link between inflammation and hepatocarcinogenesis from the gut to the liver, underlying the intimate relationship between the intestine and the liver regarding carcinogenesis. That maybe is a future therapeutic target for preventing HCC in patients with cirrhosis. There were other papers presenting future antigen tumor-directed therapy. For example, today Bruno Sangro presented a preliminary pilot trial of this new therapeutic approach. But we still, these therapies are ongoing, and we still do not know if they're going to be really addressed in the near future, I think.
Okay. And when we discuss about the treatment, it is very easy to talk about advanced HCC because there are a lot of news about the advanced HCC treatment, but do we have any news in the term of percutaneous treatment or chemoembolization treatment? Do you think that is a news in this area, or do we need to wait until the Liver Cancer Summit, that this year we will have a digital Liver Cancer Summit in February? It could be great if we meet there again as we did in the past.
There was a lot of discussion, I think, and I've read some different papers here in ILC regarding the external validation and the feasibility and applicability of the 6 and 12 score. I've read your paper that it was, I think it's a poster presentation. It's very nice, trying to underline and trying to address, is it really feasible to address this 6 and 12 score? Are you hear me?
Yes, perfectly.
Oh, I'm sorry.
Right. So if we need to sum up the audience, the best thing that you learned, the thing that you learned from this meeting.
Hello, we can't hear anything.
Thomas, do you hear us?
Can you hear something?
Yes, I see.
Oh, I can't hear. Nothing.
Thomas? I don't know if the audience hear us. I hear Thomas. Okay. And to sum up this part of the liver cancer field, I believe that Federico showed us the different studies that we have. As I mentioned before, we will wait you in the Liver Cancer Summit. This year it will be a digital Liver Cancer Summit. The organizers will be Jean de Bruges from Barcelona, Shamsa Al-Naoul from France, and Chiara Branconi from UK. The idea is to have the same thing that we discussed today, that the multidisciplinary interaction is key for us, and we believe that is the most important thing. And as EASL is working we try to work very closely with the partner societies. I'd like to ask Federico, how do you think, or how do you see the interaction between ALEH and EASL in the future? Do you think that we need to emphasize or try to find different ways that we did in the past?
Yeah, as we talked recently, I think there are really amazing opportunities to collaborate with not only with observational studies, prospective studies, but also with interventional studies, just as pilot or randomized clinical trials. I think we need to participate. We need to address from Latin America. I think it's a great opportunity. And in the name of ALEH, I really thanks the EASL for this opportunity to get each other with this this spectacular congress and all these presentations.
Thank you very much, Federico, for your presentation, and also thank you all of you to be here. I give my voice for Thomas or Franco. Thomas, maybe you continue with the discussion.
Yeah. So Maria, thank you so much. And Piñero, Dr. Piñero, it was really great to have you here also from ALEH.